We believe the prevention is not only about awareness, but also about the action. Working together, we can ensure that everyone can live with confidence and independence. Now, we will witnessing different scenario that causes falls to patient. On each scene, there will be a short discussion and questions to be facilitated by our team. On the first scenario, patient Turfataya, female, 56 years old, came in the hospital with her sister due to severe dizziness and blurred vision. She went to the hospital to seek treatment, but let us find out what will happen to her in her hospital stay. On the first scenario, what did you notice and what makes her fall in this scene? And how can we prevent the fall in this situation? Anyone? Anyone in the audience? Sir Dan, with his mic, will come to you. Can you raise?
Who wants to answer the question? So since I'm here at the back, I will call somebody here to answer the question.
Okay, sir.
So what is the question, madam, again?
On the first scene, why did Mama Turfa fall? How?
Okay, sister. What's your name, sister?
There's no wrong answer. Since you stay at the back.
Okay.
What's your name?
Sister?
From which
Department are you from?
P1,
P1B6, okay. So the question is, madam?
Sister, what did you notice with our first scenario?
Lack of assistance from department.
Yes, okay. Another answer, anyone? Thank you, sister.
Continue.
Okay, dear. Anyone here from the right side? Ma'am Raylene? Okay, anyone here from this side who can answer this one? Come again. What did you notice on the first scene, ma'am? What should the nurse do with this scenario? Okay, ma'am. Okay.
Yeah, in addition to that, proper assessment of the patient to prevent falls upon admission to the hospital is a critical step in ensuring patient safety. Early identification of the patient at risk of falling allows healthcare provider to implement effective intervention to minimize the risk. You should be thorough, systematic, and documentation. Now, after the fall of Mama Turfa, she fractured her left hand. They put sling on her hand. Mama Turfa now will be transferred to ward. Magsulat tayo. Mama Turfa. Kaya lang hindi.
Okay, another fall. So, what did you notice, dear colleagues? And how can we prevent this situation? Sir Dan?
Okay, someone
Anyone
from the
here?
front. Sister, what's your name? From which
Don't
department?
be shy, sister. What's your name?
Sir Dan, limit the patient. Improve handling with the patient. Improve handling with the patient.
Okay, improper handling of the patient.
Okay. Anything more?
Thank you.
Yes? Okay, the one from the back, raising your hands. Sir Dan?
Not here. He want answer.
Okay. Sorry.
Patient need.
Yeah, it is for the assessment again. The patient already having the fall risk and already, so the score of the fall will be more than high rate. So patient should be with the fall risk band, and also when you are transferring the patient needed assistance.
Okay, thank you, ma'am. Sir Dan, any addition from ma'am?
Improve handling with the patient.
Okay, improper handling of the patient.
Okay, anything more?
Thank you.
Yes? Okay, the one from the back, raising your hands. Sir Dan?
Not here. He want answer.
Okay. Sorry.
Patient need.
Yeah, it is for the assessment again. The patient already having the fall risk and already, so the score of the fall will be more than high rate. So patient should be with the fall risk band, and also when you are transferring the patient needed assistance.
Okay, thank you, ma'am. Sir Dan, any addition from ma'am?
Thank you, ma'am.
Action.
Same patient is still there is a history of fall, so need more assistance like that.
Okay, thank you, ma'am. So, number one, when we see the patient with a wheelchair, make sure before transferring from wheelchair to bed, we should lock the wheelchair, okay? So, never ever let the patient alone going from wheelchair to bed. We should assist them, okay? So, after the fall from the wheelchair, she sustained a fractured leg. After this, she undergone a cataract surgery and now lying in bed in the ward. Let us now see what will happen on the next scene.
ഇപ്പോഴാണ് തോന്നുന്നു ചേച്ചി ഇപ്പോഴത് ഓക്കെ ആയി തുടങ്ങി ആൾക്കാർ ടെക്നിക്കൽ സപ്പോർട്ടില്ല ടെക്നിക്കൽ സപ്പോർട്ട് ഫോളയോ ഇനി അടുത്ത ഫോളാ മൊത്തം കൈ കാല് എടി പാത്ത് വീഴുകയും ചെയ്യും
جيبي مويه وين الجرس سيستر راسي دوخه سيستر
Okay, another fall, okay? So on our last scene, what her fall in the last scene? Anyone? Okay, ma'am.
From Minnesota General Hospital. Always keep the side rails up after you finish the procedure. Right after, keep the side rails up.
Okay, number 1.
Call back.
Anyone? Any addition to that?
Okay, anyone from the gentlemen?
From
Okay, sorry, madam. Okay, sister. What have you observed, madam?
she didn't put the side up.
She's calling her actually.
Thank
Okay,
you.
side rails. Anything more? Okay, on this side, ma'am. Where's Ma'am Ray? Ma'am Ray, on this side. Sorry.
ഈ രണ്ടുപേരുടെ ഫോൺ വിളിച്ചാണ് ഇവിടെ വന്നത്.
Okay, anyone here, ma'am? Yeah, here. Your good name, ma'am?
The action earlier was complete negligence because the nurse forget to put the side rails up. At the same time, the patient has history of fall, so they did not put the bed on a lower level.
She
And
wants
at
to
the same
answer.
time, the patient keeps on calling the name of patient, so they forgot to put
raised
the
the hand.
call bell at the bedside of the patient.
Okay, 2 points. Side rails and the call bell. Any more?
Okay, addition, there is addition.
Lower bed in any time and call bells and instruct the patient
She needs it.
needed. Instruct any difficult patient call bell.
Okay, sister, thank you. Okay, ma'am, there's another.
Thank you.
Okay, ma'am.
She instructed the patient also not to get out of bed without assistant.
Yeah, thank you. Side rails is a vital part of our fall prevention. And also the call bell is essential safety features and timely assistance when they need help, mobility, bathroom use, and or getting out of the bed.
Di, railing.
And also, sister, if you
Well done.
notice, the nurse given some medication to the patient. Some medications can also cause falls. So let us remember, let's be knowledgeable. And the medication, with the medication action side effects, and shall we be aware of the list of medications that can cause falls? Okay, in conclusion to this,
While falls in healthcare settings are major concern, their consequences can be severe or even fatal. Falls can result in traumatic injuries, internal bleeding, infection, complication that can lead to death. Preventing falls through combination of measures like fall risk assessment, environmental safety, proper patient assistance, and monitoring is essential to protect the patient. Now, do you want to see Mama Turfa?
okay, nurses are the heart of fall prevention efforts in hospitals through thorough assessments, patient education. Nurses can help reduce the risk of falls and ensure patient safety. Their involvement in creating a safe and supportive care environment is the key to preventing falls, which can lead to serious injury. Just like today, unfortunately, our Mama Turfa just came to ER due to dizziness and blurred vision. But due to incidents of fall, now she has fractured left hand, fractured right leg, and also a head injury, and also an internal bleeding that leads to her death.